Good evening, ma'am.
Good evening. Namaste.
Hi, Vidita.
Hi, Sangeeta.
Not all. Hi, Vidida. How are you?
Hello, ma'am. I'm good.
Sir is joining.
Yeah. Namaste,
Good
sir.
evening, sir. Namaste.
How are you?
We
I'm
are
good,
good,
sir.
sir. So, I
Let's
guess
start.
everybody is joining. Yeah. So, this is episode 9, How to Learn to Understand Ayurveda. This is the continuation of Sri and Prasuti exclusive actually. Sri Roga has been completed in episode 8, and in episode 9 we will complete the Prasuti Tantra exclusive questions. So before starting the questions, I'd like to introduce Dr. Rajkumar sir, pioneer of SBBA, Associate Professor, HOD of Roganidana Department, Government of Puducherry, Mahi. Dr. Ramakrishnan ma'am, pioneer of SBBA, Associate Professor and HOD of Dravaguna Department, Government of Puducherry, Mahi. We both welcome you as a guest speaker in our today's episode.
Thank you.
So, before starting to the today's episode, we and Vidita both like to brief the previous episode of Sri Roga. So regarding that, the first question was regimen of menstrual cycle, myths and superstitions. For that, ma'am has explained how and why question has to be addressed, which is elaborated in Samhita. Things that has been pointed out by ma'am was no explanation of basic principle of Ayurvedic physiology of menstrual cycle in BMS curriculum. No understanding of hormonal function in Ayurveda, like what is HPO axis in Ayurveda, is not mentioned in curriculum. For which ma'am has briefly explained the answer, like importance of prana, samana, apana axis in menstrual cycle and ovulation, role of Agni in Artava, Shrotas, etc. Ayurveda being a complete science, it has explained each and every logic behind the regimen. But if we will learn Western science only, we will think it's as a superstitious, but it is a pure science only. Three rogs should be taught before or after Kaya Chikitsa. For that, ma'am has told fundamental principle of Ayurvedic gynecology is to be taught in first year itself in Kriya Sharir. Pathophysiology of gynae should be taught in Roga Nidana. Sir also added like patient with multiple pathogenesis, for example, liver dysfunction, diabetic patient, hypertension. So by integrating all this, we need to know the basic principle with which it can be treated. So identifying Hetu, when Hetu is removed, then afterwards specific treatment is done, which is mentioned in Sri Rog. On relation between Granthi and PCOS, whether acceptable or not, for that, ma'am and sir explained that we need to identify every disease by Nidana Panchak. We need to identify Rog by Nidana, Pragrup Lakshanam, Upshay, Samprapti. For example, there is a Kled Vriddhi, Kaf Vriddhi, which delay everything, Sheet Gun Vriddhi. So identifying from Nidana and all Panch Samprapti. So just by giving name as Granthi or something, it will not have any significant scientific basis. All the pathogenesis of PCOS is also needed to be identified by Nidana Panchak, else it will be wrong as per Ayurvedic science. How to comprehend uterine fibroids, fibroedema, etc. in Ayurveda. Though fibroids, fibroadenoma can be considered as Masava Shotodushti, initiated with hormones, but that's not enough. It can be developed by other mechanism also. We have to find out the initiating cause with Nidan Panchak, and for that, for correlation sake, it can be correlated with Masava Shotodushti. Is drug samban is necessary in menorrhagia like conditions. For that, ma'am has explained we can do samban if we do Sthamban on Ashuddh Rakt, it can worsen the condition. It can increase Agni Dushti. Ashuddh Rakt Vriddhi can also cause severe bleeding. Sthamban is not as such protocol for Ashuddh Rakt pathology. And further briefing will be done by Vidita.
Thank you, Sangeeta. In previous episode, explanation regarding Artha Utpatti theory was given. Ma'am had explained basic principles of Artha Utpatti and Ayurvedic physiology. Formation of Nava Rajas according to Ayurveda between Nava Rakt and Purana Rakt in menstrual cycle were stated. Difference between Updhatu Rajas and Artav Rakt were stated. Importance of learning Shuddha Artav Lakshan, Rutumati Lakshan were explained. Further, it was explained that Stana is Mool Sthan of Shukra Srutas. So there is a role of Shukra Dhatu in ovulation. Ojas is Updhatu of Shukra. So how Shukra, Artav and Ojas, everything is connected and controlled by Vayus was explained. Rutumati means ovulation period and not menstruation period. Artavagni is maintaining Shukra functioning and Ojas functioning in women. In short, importance of learning Ayurvedic physiology was explained. Further, importance of neuroendocrinology in Ayurveda, how to understand each and every stage of ovulation and menstruation was explained. Question regarding Ayurveda gynecological pathogenesis not being deciphered in modern disease was asked. In that, Sir had explained importance of Shastra Artha. According, Ayurvedic physician must know true Shastra Artha to diagnose and treat modern day diseases. Every specialty can be updated only with basic principles. Any kind of condition can be understood only with Samhita. But Samhita learning is not enough. We must be able to translate it. We should be able to translate concepts into current situation. Ayurveda is deterministic science. It uses deductive reasoning like mathematics. So to apply this science, intelligence is to be updated. We don't need new medicine. We need new intelligence. On question related to direct correlation of Sri Roga to modern diseases, it was explained that it is not correct approach. It is correlation. Diseases must be identified with Nidan Panchak Pragrup Upshay Samprapti. We need to assess the patient with all his diseases. Medicine-based treatment should not be done. Science-based treatment must be incorporated. Further, on question related to specific drugs list in Prasuti Tantra, it was explained that to treat a disease, Shastrartha are golden standard. Physician must have Tattva Gyan and then treatment must be done according to Yukti Gyan. Importance of pharmacokinetic components such as Karan, Kal and Upay must be known while choosing medicine. And while choosing medicine, Peshach Karma, Doshach Karma, Rogagna Karma must be known. Importance of evidence triad was stated. Regarding different national programs, ma'am said that it should be not included in syllabus and is for just general knowledge.
So this was the small briefing of the previous episode. You can watch the previous episode for the full explanation given by ma'am and sir. So, ma'am, as today we will discuss the Prasuti Tantra questions. So my first question is, should Prasuti be taught in first and second year because Garbha comes under Sharir Sthan?
Sangeeta, that part, I think that question we have discussed in the last session also, because the physiological aspects, as I told in the previous session, the physiological aspects, everything regarding, right? Everything regarding pregnancy, conception, everything has to be learned in Ayurvedic physiology. And menstrual cycle, ovulatory cycle, everything should be studied in physiology itself. Right now, there is no comprehensive science or cause mechanisms regarding what is ovulation in Ayurvedic perspective. How can you explain ovulation, menstruation, everything? That there is no, science of reproductive cycle in Ayurveda other than in my book. evidence-based Ayurveda and rational prescribing. So it is mandatory that this book is to be taken for a discussion, and first of all a science is to be formulated. Without formulating a science, directly going to treatment is not applicable. First of all, there should be a science which meticulously explains in Ayurveda what is ovulation, menstruation, everything stage by stage, the different phases. So that should be done first, and it has to be orientation has to be given to all the faculties of Kriya Sharira, and it has to be taught as a part of Kriya Sharira. Then coming to diagnostics or Roga Nidana. Roga Nidana is not pathology as considered now. It is diagnostics only. So coming to Roga Nidana, these aspects of diagnostic principles of gynecological disorders and different obstetric conditions, it has to be included in Roga Nidana syllabus also. Because you cannot consider it as modern medicine. In modern medicine, everything obstetrics and gynecology can be included, can be separately considered. But in Ayurveda, it is a functional medicine. Ayurveda is functional medicine. We are not dividing different systems and tissues. We are not supposed to do it. So the thing is that Roga Nidana experts should be also knowing the principles, fundamental principles of approaching a case of gynecology and obstetrics. Definitely, in order to explore the Nidana Panchaga and specific samprapti in the patient. And most of the patients, as we know, they are having comorbidities. So everything has to be integrated and connected. And then pharmacology or clinical pharmacology, I would say in Dravya Vijnana, there should be specific pharmacological principles. What are the guna karmas of treatments, Veshaja Tattvas and Veshajas, which are being employed in gynecology. So that is also not there. Nowadays, Dravya Vijnana is considered as medicinal botany, which is very much wrong. All this entire how and why a medicine is working, how to choose a medicine in any discipline, not only Prasudi, in any disease, how to choose a medicine, how to understand the mode of working of that medicine, everything is explained meticulously in Ayurvedic principles of pharmacodynamics and kinetics, which is in Samhidas, based on which my book, Dravya Guna Algorithms of Clinical Decisions, are emerged. So that should be also considered, and Prasudi Tantra, all the things, applied aspects, principles are to be taught. After that, when a student is approaching Prasudi Tantra as a main subject, definitely the faculties of Prasudi Tantra should be having a comprehensive knowledge of physiology, pathophysiology, pharmacology, everything. And they are teaching how to apply this in a more elaborated manner or in a more deep manner by exploring the pathologies in Prasudi. So that should be done. The fundamental aspects are to be discussed in different years. That is also.
Yeah. I would also like to say that fundamental things which all are related to health, should be brought under physiology itself. It should not be learnt as physiology alone. In our science, everything is explained based on kalartha karmana, hina mithyadi matraka. So samyak yoga is resulting in health. So health is to be identified along with kalartha karma. Whether kalartha karma, in this kala artha karma, this sort of health is developing. So in case of menstrual cycle or ovulatory cycle, it should be taught along with Panjavayus, Agni, Rasa Rakta Tadus, or Arthava Srotas, or Arthava Sukrava Srotas. How all these are connected with it, and what all factors are affecting or factors are influencing menstrual cycle. All these are taught in physiology itself. And what all pathological changes are there that you can learn in pathology and more specifically in Prasudi Tantra. Also this gestational period, masanumasic vritti, how it happens, how fertilization happens, how garpa vrittigara bhavas, madrija, pitrija, rasaja, satmija, atmaja bhavas are producing its effects. Garpa upakhadagara bhavas, all these can be learned in first year itself. Everything related to health should be taught in physiology itself. Our physiology is different from modern physiology. We are learning with circumstances, with all the factors influencing or affecting the health. We are learning like that. So it should be taught in the same manner. What all factors are producing normal physiology, or Kalartha Karmanam Samyak Yoga, how it is producing normal physiology of health, or Vega related. Like delivery is a Vega, Avinam Anujanmana. So when to push is when Avi develops. So it's a Vega, and Vega also should be taught in physiology itself. More detail or specific things are to be taught in Rasudi or Sri Roga, and basics related to health. Everything related to health should be taught in physiology itself. It's what I wanted to add.
Thank you, sir. Thank you, ma'am. Vidita, next question.
Sir, and ma'am, my next question is based on shlok. Shuddha Shukra Artava Sattva Swakarma Klesha Chaudita Garbha Yukti Avshad Agni Nirvarane. Does that mean we need Panchkarma for Artav Shuddhi and Shukra Shuddhi for healthy progeny? Does Panchkarma package going on for this should be promoted?
So Arthava Shuddhi and Shukra Shuddhi, and whether Panchakarma you are asking about, right? It's a little bit feeble to me.
Yes, ma'am. Is Panchkarma package is going on for this should be promoted?
Yeah. Yes. So Shuddhe Shukrartave Sattve Swakarma Klesha Chodida Garbha Sambadhide means Shuddhi, Artava Shuddhi and Shukra Shuddhi are very important for a healthy conception. There is no Ritu Kshetra Ambu Bijana Samagriya Anguro Yada. So Ritu Kshetra Ambu and Bija all are equally important. So Shuddhe Shukra Artave means what? Artava Shuddhi and Shukra Shuddhi means Dosha Dushti should not be there in Artava and Shukra Dhadus. That is what it means. Shuddhi means that it should be in a pure form. Shukra Dhadu should not be impure. And Artava Dhadu, Artava Ubhadhadu should not be impure. Means there should not be any kind of Dosha Dushti. Dosha Dushti in these Dhadus at the time of conception. So Dosha Dushti can be eliminated by two ways of treatment are there. There are Shodhana and Shamana procedures. It's not like by Shodhana alone. Shodhana is specifically indicated in Prabhuda Utklishta Dosha status, where contraindications are not there and Shodhana karmas are absolutely intended. In such condition only of Artava Dushti and Shukra Dushti, Shodhana karma is intended. Otherwise, in the present scenario, Artava Dushti is happening. Shukra Dushti is also happening in females. It's not like Shukra Dhadu is present in males and females, both. And we know Shukra has an important role in what you call female fertility, which is being explained in the last session. So the thing is that in the present situation, Rasa Dushti is one main cause of Artava Dushti. Direct Artavaha Sroto Dushti Karanas can be there. Panjavayu Nidanas, Panjavayu Dushti Nidanas are there. Sometimes Agni Dushti Nidanas are working. Sometimes Sama Dosha might be the cause of Artava Dushti, Sama Dosha. Sometimes it could be Ama Visha. So it can be autoimmune causes, metabolic causes. Sometimes woman might be having hormonal dysfunction, Agni Dushti, or Agni dysfunction might be there. Panjavayu dysfunction, Nidanas may be there in the women. So Shodhana is not a universal antidote for all these things. Many conditions like Amavesha, Samadosha, then Agni Dushti, all these stages, whatever we are finding today as cause of these Artava Dushti and Shukra Dushti is not generally intended for any of the Pancha Shodhana procedures. That is the reality. So Pajanam, Divanam, Shutrit, Vyayam, Adabam, Ayurveda, Saptavida Shamana itself will be a main therapeutic therapeutic entity to treat Artava Dushti and Shukra Dushti of contemporary scenario. Panchakarmas as such a very limited role. I would say very, very limited role, because most of these conditions today are emerging by Rasadushti, Agnidushti, Samadosha, Amavisha, Medo Another important cause is Sleshma Rekta Mamsa Vigara Praye Meda, Prameha Purvaryuba, Staulya Upadrava, all these conditions are the cause, where Shodhana is not intended as primary step. Wherever specific indication is required only, that too in restricted conditions only, Shodhana has application. That is my point.
Sir, the mic is mute.
I would like to add that Sutti and Shodhana are two different terms. So those who are doing Shodhana is getting confused with the term Sutti. Sutti is pure form of Dhatu, is Sutta Dhatu. And Shodhana is a Behir Doshan. When it is afflicted by a dosha, and if it is in excess quantity or if it is in an Utklishta state, it has to be removed. So Shodhana is done only in specific conditions. When there is Bahudosha Lakshana or when there is Utklishta Lakshanas. In only these two conditions we need to do Shodhana. Otherwise, Shuddha is in healthy individuals, it will be Shuddha itself. And if you want to make it more pure form, so pure form is not by deep toxifying or, and Shodhana is not detoxification, or it is not purifying the body. It is removal of doshas only. So doshas can be neutralized or subsided by Shamana treatment also. Then also dosha will not be there. And if it is removed also, dosha will not be there. So you cannot specifically say that Shodhana is detoxification or Shamana is not detoxification. It's not like that. Whenever a subject is healthy, it is in Shuddha status. So if you want to make it more pure, you have to make Agni unhindered, or you have to kindle Agni. So when Agni is functioning properly and all the Pancha Vayus, Vayu Pitta Kapha, the homeostasis is maintained, then it is termed as Shuddha Artava and Shuddha Shukla. So it is not Shodhana Chikitsa that is intended there. It is to kindle Agni, hormonal functions, and making the homeostasis normal. So it will be the purest form of Artava and Shukra that will be getting fertilized. Yeah.
Thank you, ma'am.
Thank you, sir.
Thank you, sir.
Thank you, ma'am. My next question is, can Masanumasic Garbhini Paricharya can be applied to all pregnant females, or it can be generalized to all, whether the textual medication and treatment are to be blindly imposed in pregnant women stage by stage?
Actually, it's a very relevant question, because nowadays it is like most of the times what Prasudi Tandra they are doing is blindly adopting. Not only Prasudi Tandra, generally medical officers or whoever it is, they are blindly adopting everything as such from the textbooks and applying. But it is not the case. Whenever we are applying a science, we should consider the contemporary scenario in people. Without assessment of individuals, when we are blindly applying a science, it is not fair. It is not fair, because we cannot consider such a kind of application of science as scientific application. It's not the problem of science. It is the problem of intelligence. We must have translational. That's why Acharya told us to develop what you call Prakasha Jyoti, Shastram Jyoti Prakashartham, Darshanam Buddhi Atmanaha Tabhyam, Vishak Suyuktabhyam Chigilsanna Abaradhyadi. So we should have that translational kind of knowledge. What, where, when, what is the status of the patient today? It's not patient, of course. Physiologically, pregnancy, when a woman is conceiving today, it's very important to elicit the history of the woman. And in the history of the woman, when we take a detailed history of the woman, we understand that in olden times, what kind of diet, regimen, and treatment for diseases or inability to conceive, if it was there, how it was managed before 5,000 years, is not the way what is managed today. So we know that everything is getting managed by artificial means. When thyroid is there, most of the women will be on thyroid medication, or PCOS is there. Metformin might have been given for that. Sometimes the woman might have had hormonal drugs for several things, sometimes to delay the menstrual period or to stop period owing to certain reasons. There are many artificial interventions which are happening in the reproductive hormonal cycle of a woman even before conception, even before marriage also. And to suppress pain, girls are taking painkillers. Even paracetamol can alter hormonal functions. So in this situation, when a woman is conceiving, first thing what is to be understood is the history of the woman, whether she was having any problems and how they were managed, what kind of diet the girl was practicing, whether it was healthy or whether it was junk food diet, and whether the conception was natural or artificial, supportive, or whether still she is on any other drugs or medications for any other diseases. All this, her proneness to what, her satmiyas, addictions, exercise, everything has to be explored. And after that, when we are deciding a dietary protocol or a medication protocol, it's important that it should be well in tune with her body condition, right? In the first semester, in the first trimester, what is most important is protection of immunological response. Immune response is that which is to be protected, because most of the times naturally abortion happens when there are some genetic abnormalities. Body itself tries to eliminate that fertilized ovum, and other than that, abortion is happening mainly by immunological reasons. Even natural abortion can also happen immunologically. Otherwise, if the woman is having autoimmune disease or thyroid dysfunction or sometimes torch infection or some other causes, so it is very important in the first trimester to protect the immune system of the woman to prevent abortion. So the thing has to be like not merely adopting the same medication and treatment what is advised in the text. You have to explore the woman and understand the condition, whether she is, if she is not prone to any kind of immunological dysfunction or metabolic dysfunction is not there, we can directly go for, we can adopt the fundamental protocol. Madhura snigdha shidani laghuni cha hidani cha ojasam vardhananyahu, in the same way as how in children it is advised. Madhura snigdha shidani laghuni cha hidani cha is advised. So everything like that doesn't mean that when the woman is having a cold or sinusitis, how we have to manage that sinusitis in first trimester. That differs. So according to the status, variable, state and stages, but the fundamental logics are to be adopted from the science. For example, fourth month, it is recommended that fourth month Bella is being developed. So it is recommended Mamsarasa and other things. And Grida is also advised from fifth month. Grida has, so we must understand that medicated Gridas, Pitta Anilaharam, Rasa Shukra, Ojasam Hidam, Nirvabanam, Mrudugaram. So when we are giving Grida to a pregnant woman just by blindly considering that it is fifth month of pregnancy, when we are blindly choosing Grida, means it is wrong. We must understand the metabolic status, how much Agni Bala the woman is having, how much exercise, how much Satmiya she is practicing, whether she is prone to any kind of disorders of Agni Dushti. These are to be rectified first. And if the woman is on thyroid medication, asking to continue thyroid drugs and prescribing some Ayurveda medicine prescribed in the text, mentioned in the science as such, it is also very wrong. It is Kriya Sangara. And every stage we must understand that according to the particular stage, Chedanayasya Panjame, Shashte, Siras, Nayu, Roma, Bala, Varna, Nagatvaja, Sarvanga, Samburnai, Bhavo, Pushini, Saptame. So it is for understanding what is happening month after Ojo, Ashtame, Sanjaradi. So it is time to boost immune response in the 8th month. So that because Ojas is traveling from mother to fetus. So we can give Gridas medicated gridas, ojasya gridas, right? But if ojo dushti is there, we have to choose those gridas which are ojo dushti hara, ojo vyabat hara. So it is not like this medicine itself is to be bela is advised. Bela Kshira Kwada is advised in the first trimester. So every woman Bela Kshira Kwada is given means some will be having Samadosha, some will be having hypertension or some metabolic disorder. Sometimes she will not be doing any activity at all and she might be on progesterone supplement. So when we are prescribing Bela, we should be sure that she is not on any other drug, whether she is directly intended for Bela itself or something else. So exploration of the woman, that for that guidelines should be evolved according to state and stage of the woman in every month of the pregnancy, every trimester. We can adopt the fundamental logics. Yes, fundamental logics we can adopt from the science, but it is not fair to copy the medications as such in every state and stage. Diabetes, more prone to diabetes in 6th month, after 5th month, more prone to pre-eclamptic toxemia after 20 weeks. Nowadays, woman is more prone to pre-eclamptic toxemia after 20 weeks. So for that, how can we prevent that? For that, placental health should be assured by proper Ayurvedic scientific guidelines. So every aspect, a woman having pre-eclamptic toxemia, she should not be given any Bela or Ashwagandha or something like that, which are Belia drugs. So all these things we must be knowing hetus, hetu samprapti, is it not? We should be knowing three aspects: hetu, tasmad vigara prakriti, adhishtana andarani cha, samuthana visheshamsha, buddhva karma majare. So that should be the approach. And for easy delivery also, what can be done? Last vata anulomana measures like yoni pichu is advised, and vata anulomana medications can be given just before delivery to facilitate. Again, we should consider the BP of the woman, general health of the woman, Bela of the woman, everything has to be considered for that. So these minute, subtlemost aspects, that is making Ayurvedic antenatal care and postnatal care scientific. That is not explained today in Samhitas. We are the people to emerge scientific guidelines, adapting to modern woman. Yes. That's all.
Shastra comprises of general principles. It is not in this patient, this has to be given. It's not that like that. These are only Upadeshas. It is mentioned in Vithiling. So from general to specific, we are doing deductive reasoning. So it is not whatever is mentioned in science, you can adopt it as such. We have to assess the nature of the patient with Navavitha Pariksha. Except Vikruti Pariksha of Dashavitha Pariksha, all aspects are to be checked. Prakriti, Sara, Samanna, Sattva, Satmiya, Pramana, Ahara Shakti, Vyayama Shakti, Vayas, everything are to be considered. Then you will be able to understand the nature of that Sharira. Then, according to the state and stage, like how to maintain health in each stage is explained in the science. So, according to that, in this nature, how to adopt. And also, according to the strength of the patient. Also, so these three factors are to be assessed, like nature, stage, and strength. Based on this, we can adopt the principles mentioned in the science. So it is not like whatever is mentioned in the science, you can adopt it and tell that you are doing scientific management. So it's not like science. Science doesn't advocate like that. So Buddhimadam tu udaharana matrameva. All these upadeshas are just udaharana only. You have to assess the patient. So clinically or in the subject, you will be assessing all these factors and determining based on the principles mentioned in the science, which is to be adopted. So Yukti and Upaya are to be determined clinically only. It is not, you cannot blindly adopt whatever is mentioned in the science.
So this antenatal, I would like to add one point which I have considered, that in antenatal care, 5 parameters are to be considered properly for every woman in Ayurvedic scientific antenatal care. It is I, M, H, N, and D. I, M, H, N, D. I for immune status, M for metabolic status, H for hormonal status, N for nutritional status, D for drug history. So this 5 points are very extremely important in Ayurvedic point of view in antenatal care. How many of the doctors are assessing this for deciding stage by stage Masa and Masika treatment? I don't know, but this should be considered as basic standards for assessing all the pregnant women and deciding what to do. IMHND.
Thank you, ma'am. Thank you, sir. Next question, Vidita. My next question is, sir and ma'am, any relevance of Punsavan karma done in the name of changing or healthy childbearing, as it is not legal? If it was, is it to be done in healthy status, or it can be done in women having some diseased condition like
Kumsavana, it is misinterpreted that it is for male child. Am I audible?
yes, yes, sir. Yes, sir.
Am I audible?
Yes, sir. Yes, sir.
Kumsavana is misinterpreted as it is for male child itself. It's not like that. It is Putro Utpada Sthiti Pradam. To have a progeny, to help in fertilization, plus to make the child healthy, its fetus healthy, what all things are to be done. And it is scientifically explained as Shukrasya Bahulya Jayade Puman. So there is no need of further explanation, or after fertilization you cannot change that. Shukrasya Bahulya Jayade Puman. It is already mentioned. And Rectus is 3. So if it is Artho predominant, it will be 3. And if it is Shukra predominant, it will be male itself. So you cannot change after that, after fertilization. So whatever is mentioned after that is Kumsavana, in the name of Kumsavana Kriya. It is for Putra Utpadana plus Sthiti Pradam. In between, it is mentioned that Snehe Kumsavane Sniktam. So Snehe Kumsavane Sniktam means it is not to make it to a male child. What are things you need to do is not mentioned with that line. Snehe Pumsavane Sniktam is to make both Shuddha Shukrartava more healthy, more strong, and more prone to fertilization. To make it more prone to fertilization is Snehe Pumsavane Sniktam. And Syad Abathyam Cha Kamadaha. So you can have with desired qualities. It is not like you can change the gender. With desired qualities, you can make the child. So for making the desired qualities and for stability and for protection of that fetus or that fertilized egg, what all are mentioned is mentioned. And mantras are also mentioned, which is Deva Vyapasraya, which is again a manasik approach. And Nasya is made to do, or some medicines are to be taken. With medicines, it will not change the gender. If it is Nasya is done, it will Nasohi Shirasa Dwara. So it will go to Shiras only. It will not change the gender. So once fertilization happens, Shukrasya Bahulya Jayade Puman, Rectus is 3. There is no change for that. If you want to improve the qualities of the child who is to be born, or for the protection and stability of that embryo and fetus, this Pumsavana Kriya is mentioned. So it is misinterpreted, and many are making fun of that also. Like Pumsavana Kriya is what all are not possible are mentioned in science. So science has clearly mentioned that Shukrasya Bahulyal Jayade Puman. And Syad Abathyam Cha Kamadaha means it is not you can change the gender. It is to improve the qualities of the embryo and make it stable and protected. That's all.
thank you.
So many
Ma'am, anything
barriers
you would like to
themselves.
No, I think that is a complete explanation. Yeah.
Sir, many Vaidyas of different state, they claim that they will change the gender, and many physicians also say that I have seen that child gender has been changed like that. So it's just a mere coincidence or what?
Uh, they are just claims only. It's not scientific. Beli Purushakaro api Deivamapyati Vartade. So, to nullify the previous misdeeds which you have done in this life or previous life, what all things you have done wrong, that can be corrected by the deeds of this life. So, before that child is conceived, you will be doing so many things which to prevent Daiva Vyapasvaya methods, to prevent that Papa or Pangilatva of Manas. What all things are done, what all things are there, it has to be removed by Daiva Vyapasvaya Chikitsa and by good deeds. Dana Shila, Daya Satya, Brahmacharya, Kritanyada, etc. are good deeds with which you can improve the quality of your manas also. So, before conceiving, your manas also should be pure, because it will be also uh, transmitted to your offspring. So, to make the manas pure, to make the both the individuals healthy, all these are mentioned. And scientific version is Shukrasya Bahulya Jayade Kumar. Nobody can change after that. After fertilization, you cannot change. And all these things will be affecting the prakriti of that individual. Shukrasra Garpini Bhojya Cheshta Garphasya Rudushu Esya Dosho Athikastena Prakriti. So Prakriti develops by nature of Shukra, nature of Artava, Garpini, gestational period, and what all regimen food which that lady is practicing. All this will have an impact on the Prakriti or the health of that child who is going to be born. So all these are false claims and it is not scientific.
Thank you, sir. So my next question is, do Ayurveda have any standard protocols for managing preeclampsia conditions? Because till now we seeing mixopathy on OPD level for such condition along with general approach of Ayurveda principle into patient.
Preeclampsia is a condition which is fundamentally it will be rise of BP. Generally, it develops after 20 weeks, and with the cause, exact cause is not yes deciphered, but it is supposed to be assumed to be the cause is emerging from placenta. That Vaishadya in placenta or ischemia in placenta is considered to be a cause. So this woman will be having raised BP, and there can be swelling on the feet and even on the face. Puffiness also can develop. Proteinuria can be there. There can be many other problems like vision problems can be there. And when we analyze the cause mechanisms in modern medicine, it is like antihypertensives are administered to control BP, to control edema. Diuretics may be. I'm not sure. I'm not a modern medicine doctor, but still they are considering every symptom with analytical reductionism, and they are not considering on cause mechanisms. Though they know that placental ischemia is the cause. Ischemia in placenta, placenta is having a very big immunological role also, and we know that maternal cells and fetal cells are present in decidual placental surface, which is performing an immensely huge role in innate immune response against all the pathogens. So placental ischemia can easily develop by any sort of infection or even infection mismanagement or any sort of abnormal immunological natural response or abnormal response created by wrong treatments before conception. And even before conception, things can also, because systemic immune response is being developed. So it is, in one word, it is research shows that, detailed research shows that placental ischemia is developing by inflammation and oxidative stress. Inflammation and oxidative stress. But when you are looking for inflammation, you cannot find inflammation on the placenta. But the molecular level studies decipher that it is by inflammation and oxidative stress. Vaishadya of placenta that a woman is getting, hypertension and pre-eclamptic toxemia. So how we have to manage being a scientific Ayurveda practitioner? Definitely it should be based on the cause mechanisms. Inflammation in Ayurvedic perspective is to be known for that. What is inflammation? Inflammation is a systemic immune response. So how you can decipher it in Ayurvedic perspective? Again, SBBA has done all the groundworks for the same. How to understand an inflammation, local or systemic, how to understand the immunological mechanisms happening there, and how to reverse the inflammation. SBBA has definite scientific guidelines. So once the inflammation reversal cause mechanisms are adopted by appropriate upaya, we have to analyze the woman and understand which upaya is required, whether what is required there, bhajana is required or shamana is required or snehana, direct snehana is required. It has to be explored, and what kind of treatment is to be, that is what is called ubaya, yukti medi ubaya. So what kind of logic is to be applied in that particular woman? There cannot be a common standard for treating pre-eclamptic toxemia. We can understand that it is inflammation of placenta and oxidative stress of placenta. So we have to be focusing, not just giving some medicine for hypertension blindly, anulomana, vata anulomana, or vata generally kritva pagam malanam yadhiktva bandham adonayet, anulomana. Anulomana medicines are sometimes given, sometimes patent medicines which are applied in BP. Most of them are containing Belya dravyas also. I don't know how they are fitting in this hypertension, because Bela, Ashwagandha, all these, Arjuna is a Belya dravya. Because it is mentioned as Hridya, it is mentioned in what you call hypertension also. So Hridya dravyas are not Vatanulomana. So sometimes all these things are very much confusing today. There is no clarity in understanding hypertension also, other than what is done in SBABA. So basic thing is that we have to reverse the what cause mechanisms involved in pre-eclamptic toxemia and reverse the hypertension. So the results are very fast. Once we are focusing on inflammation, we can check BP after initiating guidelines. The swelling will subside, BP will subside. We have to advocate scientific diet and regimen also for the cause mechanisms. Then only we can address and reverse the thing. That is what.
So
Your mute.
mic is mute.
Vaishadhya, what the cause of Vaishadhya is to be understood. Vaishadhya can initiate prana vyana mechanisms. So that's why BP is getting raised or proteinuria is happening. So identify the cause of Vaishadhya and correct. If Srota Shuddhi is achieved, prana vyana automatically comes to normal. If it is a prana initiated cause, we have to treat for prana or vyana. So such specific approaches should be there, and not blind one medicine is suggested or one protocol is kept for pre-eclampsia. It will not be fair. It will not be scientific.
Thank you, sir. Thank you, ma'am. Vidita, next
I would
question.
interfere.
Yes,
I would like to know whether
yes,
such conditions
yes,
are
ma'am.
being handled in Prasudi OPDs. What you are finding now in Prasudi
Yes,
OPDs, pre-eclamptic toxemia.
ma'am. Hypertension, diabetes, only. Um, so far, I have seen this two only, ma'am.
Okay. So
Yeah,
hypertension in the pregnant woman you have seen in OPD.
yeah.
Yeah. So do they manage by Ayurveda or modern medicine, or how?
Modern medicine, like
Gestational
a
diabetes
mix.
also.
Yeah, mixopathic.
Mixopathy.
Yeah,
Kriya Sankara-itis. Nacha Kriya
yeah.
Sankaro. Both mechanisms are opposite. Mode of action is opposite.
Also thyroid, also, ma'am. Hypothyroidism.
Okay.
Next question.
My next
Vidita,
question
next
is
question. Uh, am I audible?
Yeah.
Yeah.
You're
Vidida?
audible. Getting
I guess she's having some network issue.
Yeah.
The next question is, what is the utility of asana during pregnancy? Should it be advised or not? Because Garbhini Tikshna Aushadam Vayama Vaivaya Varjinam. Nowadays, these asanas are included in number of pregnancy cases and Garbha Sanskar also.
Because we are integrating yoga in Ayurveda, that's why this is happening. But as such, as Acharya gave very clear-cut instruction that this asanas and other abnormal postures can vitiate Panchavayus. And Panchavayus are chiefly important. They are very vital in healthy maintenance of pregnancy and delivery. So apart from Chankramana, any sort of abnormal posture, practice of abnormal posture, etc. in scientific Ayurvedic point of view, it has to be considered. All the pros and cons are to be analyzed very much before recommending any yoga asana for a woman, pregnant woman. I mean, it's very important. Yeah.
uh, yogasanas, if one is practicing and this is this is not a pathological condition. It's gestational period is not a pathological condition. If they have practiced it before, they can continue that. But as treatment, if they are doing Ayurvedic treatment or Ayurvedic guidelines, if they are following, asana is it can vitiate vyana vayu. Vyano adhigamana tyana krida vishama cheshtidai. Vishama cheshtas. So abnormal postures. So normally we won't be assuming asanas. So once if they are practiced, they can adopt, but it is not Ayurvedic science based. So one if wishes to follow Ayurvedic guidelines, then asanas are not applicable or it's not advisable.
Also,
Thank you, sir. Yes,
following
ma'am.
it also when she is coming to adopt Ayurvedic guidelines, scientific Ayurveda guidelines, what is her status? That will be determined by the physician. Whether she is in a status contraindicated for yoga, then definitely a woman who is following before also cannot be permitted if she wants to continue Ayurvedic scientific guidelines. Yeah.
Thank you, sir. Thank you, ma'am. Next question. What is your view on Garbha Sanskar package? Is it totally wrong? What if someone is doing Garbha Sanskar considering every state and stage of the patient? In that case, can it be done?
So how it is done, Garbha Samskar, considering every state and stage, how it can be made as a package? That's what I don't understand. Are there Garbha Samskara packages today?
Yeah.
So what they
Yes, ma'am.
are Garbha Samskara package? Can I have a brief idea for audience sake also I'm asking? According
Uh,
to your understanding or your
uh,
observation.
I will explain, ma'am, my experience. When I was in first year, there was one seminar in which the lady who is lecturing the topic was genetically modified child versus Garbha Sanskar. So, in today's modern era, genetically modifying children are being born. So, versus Garbha Sanskar, on that topic,
Study
she
was
has
conducted.
made a brief. Yes, sir.
Study was conducted or
No, that was a brief PDF. Theoretically, she has made. So in first year, I got very fascinated about seeing all those things. Like, okay, this thing can be done like that. Later on, when I got to know that the basic education is itself is going blunder. So the treatment is obviously it's like what is written in textual. They are doing the same things without analyzing the state and stage of the things. So that was my experience in first year. Although I have not seen as such someone the package list I have not seen actually, but yes, I have seen the advertisement of Garbha Sanskar package. Mostly I have seen from Maharashtra or like that only
What
in
they,
that state only.
what they have included in it? Medications and procedures?
I guess so. Like whatever it is mentioned, 9 months, whatever it is mentioned in Charak Samhita and Shisu Samhita, that's how they have made the package actually,
Every
more or less
woman.
like that.
Okay.
Yeah, I
Yeah.
guess.
Okay,
So that's
Vidita?
already answered.
No, my
Yes,
second part was
ma'am.
actually not is not related to Garbh Sanskar package. My second question was if someone in clinical OPD, if someone a patient is coming, pregnant woman, then can someone analyzing state and stage, then someone can do Garbh Sanskar or not?
Okay.
Yeah.
Vidita, what would you like to have? Add
No,
on to
ma'am.
this
It's the same.
same. Any
No,
experience,
ma'am.
Darshini?
No, I'm not
Okay.
experienced as such anything.
Okay. So this Garbha Samskara is to get a healthy progeny. In one word, it is to get a healthy progeny. So the parameters which I have told in the previous point where I, M, H, N, and D. I told you, immunological factor, metabolic factor, hormonal factor, nutritional factor, and drug factor. All these things after assessment, whether what all things are to be done stage by stage to get a healthy progeny. That is what is to be deciphered in the particular subject. It cannot be common. Common, we can give something for immunological protection. We can give a medicated water, maybe in many women together, but still there can be variations. Still there can be subtle most variations in many aspects. So Garbha Samskar package as such is not ideal. It is very irrational, and every subject has to be assessed by these parameters and decide what is required for a healthy progeny in that particular subject. That's all.
So stage by stage you can do, but it should be scientific. Like you need to understand that first trimester is more growth is happening. So it is kapha predominant state. Then maturation is happening in the second stage. And in the third stage, finally the mature embryo or fetus should come out. So for all this, what all things are needed in that subject needs to be determined after assessing all these parameters, nature, stage, and strength of the subject. We need to, if at all needed, you can adopt measures. This samskara could be done.
And also in between, if in a sick woman who is having an evident pathology, how this package gets applied. That is also my confusion. As I am in Dravyaguna Vijnana, I am not seeing women who are coming for Garbha Samskara as such because I am not handling a Prasudi OPD. But still, if a woman is coming, it is not appropriate before assessing all these parameters. It is very, very undesirable and unhealthy for the woman to adopt blindly all the samskara, I mean all the medications and procedures as such.
Thank you, sir. Thank you, ma'am. Vidita, next question.
Ma'am and sir, my next question is Garbhini Paricharya has to be followed line by line, or it seems superstitious to use. What?
The second part, what she said was, it's look moreover as a superstitious to us. What is the scientific reason behind that?
We know that Garbhini Paricharya is very important. It is mentioned like a pot brimmed with oil. It is being carried without even letting a drop of oil fall down, right? Something like that. It has to be a Garbhini
Yes.
has to be protected, just like a pot filled with oil up to brim without even spilling a drop. So that much scientific care is required. So during that time, what all risk factors were there to the woman of those period? Based on that, those guidelines, fundamental guidelines are formulated by acharyas. Based on the risk factors, prone to happen for a pregnant woman in that period. But coming to this period, what all risk factors are there for a pregnant woman in every trimester? First trimester, there can be impaired, there are chances of abortion. Second trimester, there are more chances of metabolic imbalance and hormonal dysfunction, and also hypertension like secondary complications. And third trimester, again, same kind of problems are there. So the thing is that we have to formulate Garbhini Paricharia guidelines based on the contemporary situation. This part is lacking in today's Prasudi Tantra, especially in Ayurvedic obstetric care. First of all, we must be able to formulate specific guidelines in accordance to Masanumasic Garbha Paricharia based on the woman condition. So we can plan according to modern medicine. They are pre-conception and immediately after conception, they are prescribing iron and folic acid tablets, right? Iron and folic acid is being prescribed. Why? Because embryological and neuronal development of the child, folic acid is important. Like that, they have their own substantiating points. But why can't we do better? We can do 100 times better, considering every woman, their unique internal environment. We can do everything to protect her pregnancy in the first trimester by understanding the cause mechanisms which are Madhura Snigdha Dravyas. If we are giving, we can wisely choose. Sometimes Tikta Dravyas may be required if hyperemesis gravidarum is there, or even normal physiological vomiting is there. How to manage that? We know we have Santarpana Dravyas. We have Santarpana Dravyas, Tarpana. There is a very important treatment principle or management principle called as Tarpana. How to do Tarpana in a woman who is having hyperemesis gravidarum. We know within minutes, within hours, we can stabilize the woman without any drip. We have such kind of potent guidelines how to do Sandarpana. So that is to be taught to at least Prasudi Tantra students. I mean, students who are posted in Prasudi Tantra in BAMS and PG. PG, of course, they are fully handling Prasudi cases only. So stabilization guidelines are to be taught instead of folic acid. Why to advise? I have seen many Ayurveda doctors themselves consuming folic acid and iron tablet, calcium tablet, continuing their thyroid medications before and throughout pregnancy based on modern medicine. See, if they themselves are not ready to adopt scientific Ayurveda guidelines, then how can they treat others? In my opinion, it is cheating only. It cannot be called as treating, because once they are not adopting these pregnancy care guidelines, Garbhini Paricharia guidelines in themselves, even for anemia. See, women are very much scared when they get urinary tract infection or when they get bacterial infection. Immediately they are resorting to modern drugs because they are scaring these women. Doctors, I mean doctors who are Prasudi experts and medical officers. Medical officers, let us leave. They are not confident. Let us leave them. What about Prasudi Tantra experts? They are also not following Ayurvedic scientific guidelines. Large majority of them are not following it. So this will change only if there is how we can protect pregnancy, how we can. Another important aspect in first trimester is treating infection, preventing infection, immunological protection, Bela Samrakshana, Ojo Samrakshana. That is very important for successful implantation and successful growth of the progeny. And second trimester, metabolic balance. Acharyas are recommending so many principles how to do, right? So these principles are to be adopted based on the woman's conditions. It is not like thyroid has to be, thyroid medication is to be continued. Gestational diabetes is there. Many are starting insulin. We can prevent such insulin therapy and all by accurate scientific principles. So that is to be taught in Ayurveda. How to understand gestational diabetes, how to understand pre-eclamptic toxemia in pregnancy. Does MD syllabus of Prasudi Tantra has that part. I don't think there is a part called Ayurvedic concept of pre-eclamptic toxemia. Ayurvedic exploration of pre-eclamptic toxemia. What are the guidelines, diagnostic guidelines of PET woman, treatment guidelines of PET woman, threatened abortion, diagnostic guidelines? We can adopt modern aids. Treatment guidelines of threatened abortion in pregnant women. How can we do all these things? Bleeding happens immediately. Even Ayurveda gynecologists are referring them to modern. When we understand that by the nature of bleeding, we can understand whether it is an emergency, or that part is very important to know, whether it is a medical emergency or surgical emergency. If it is a surgical emergency, definitely it has to be referred on time. But if it is not a surgical emergency, how we can medically manage a woman who is getting sudden unexplainable bleeding in any stage of pregnancy, more prone to happen in the first trimester? How to manage it? Our acharyas have mentioned this many things like garbhasrava, garbhapada, what to do after garbhapada, and what all guidelines. Everything is mentioned in my book also, obstetric care book also. And these things are to be taught specifically in women, patients, not patients, subjects, women subjects who are coming to OPD for maternity care. And we can check all the parameters, blood parameters, to assess their immune status, metabolic status. We can check their BP, if swelling is there. I got a woman with facial puffiness and proteinuria, 2+. Her BP was also slightly raised. So by adopting the right treatment principle, she was able to be reversed in 1 week. Next review, when she came, everything was normal. No puffiness, no BP, BP got normal. So this is, then that woman is, what is happening to that woman? Her chances of continuing healthy pregnancy is getting more. When we are initiating the right scientific principles to stabilize her Agni, Ojas, Rasa, everything, what Panchavayus, then healthy pregnancy is continuing without any interference. Garbha Vikhada Garabhavas, we are preventing, and she is prone to get a normal labor and normal healthy progeny. So we are protecting women when we are managing one disease, just one condition in a pregnant woman. When we are managing scientifically, I will underline that word, scientifically. When we are managing one condition in a pregnant woman, it's not like some adjustment what modern medicine is doing. For anemia, prescribing iron tablet is not our way. We are understanding why anemia has developed, whether it is only mere nutritional anemia or whether it is secondary to some other cause, chronic infection or inflammation, something is there. When we are reversing it, not only that HB is improving, but we are protecting both mother and baby to get many IUGR conditions. I have treated few cases of IUGR also, where they have recommended protein powder and so many things, and still it was IUGR only. Such case, we are prescribing granules of medication, scientific nutrition, stopping all the protein powder, everything. First of all the Adisandarpanajanya, what you call diets and regimen are stopped. Bed rest is stopped. Advise the woman for Chankramana. All these things itself will improve IUGR, because we know that it is not by directly, baby is not eating everything what mother is eating. We know that it is through Garbhanadi, that Upasneha, you have studied that, right? So the thing is that Rasa Shuddhi is very important, Panchavayu functioning is important. So these things are to be observed and taken care of. That is what Garbhini Paricharya is meant to be. And these things are to be included in the syllabus. Prasudi BAMS syllabus, as well as BAMS, what can be done is the pathophysiological aspects can be taught in BAMS. Pathophysiological aspects. What is, how do you understand PET in Ayurveda? How do you understand the thyroid dysfunction, the consequences of thyroid dysfunction in pregnancy in Ayurvedic perspective? How do you manage allergy or autoimmune condition in pregnancy? These things are to be taught in BAMS. And Prasudi MD means patients directly, it has to be shown in the patients. In BAMS also, of course, but the detailed things, detailed avevas or components of pathology are to be discussed in Prasudi Tantra OPDs in MD, and patients are to be more and more handled by Ayurvedic treatment guidelines, scientific Ayurveda guidelines based on the pathophysiology learned in BAMS. That is what is to be required. Yeah.
What all that appears to be superstitious is based on Western medical system. It is not Ayurvedic system. It explains based on Yukti Vyapasraya or Deva Vyapasraya or Sattva Vajaya. So, Shopra Kupekshanam. You should not look into deep wells. So it is not superstition. Once if the lady gets frightened, that can result in abortion. So to prevent all those things, Madhyam Amisham, one should not take Madhya and Amisha. So Nivrta Amisha Madhyoyo Hidashi Prayata Shuji Nija Agantapi Unmadet Sa Nivartadik. So he will not get Nija and Agantu Unmada if he is abandoning Madhya and Amisha or Madhya and Mamsa. So non-veg and Madhya are asked to avoid. So that is not superstition. Or in modern day, they won't be believing all these things. But it has got impact in Manas, Sopra Kupekshanam, and many other things are mentioned. They are not superstition. It is superstition according to Western medical system. In our science, everything is based on our principles, like Yukti Vyapasraya, Sattva Vajaya, and Deva Vyapasraya.
And all these bhaya, krodha, all these negative feelings can cause ojakshaya also. So it is a direct cause of ojakshaya. Ojakshaya, if happening in a pregnant woman, it can land in serious complications. So maybe that is why all these practices are advised so specifically.
Declined ojas state is a very important point in considering the pregnant status. So ojas status will be very much declined. So even mild things can also cause Garbhasrava or Garbhapada.
Right. Thank you, ma'am. Thank you, sir. Actually, my next two question was related to that only, but you have answered. My question was actually, is it necessary to remember any ANC protocol as allopathy, such as use of folic acid, iron, calcium supplement, TT vaccination, use of steroids for fetal lung maturity, use of NTD, etc. Regarding supplements, do we have to be dependent on supplements? How we can understand this in Ayurveda?
That's what.
So,
So the things are already explained. When modern
yeah.
medicine is having a systematic protocol to adopt, that is their success. But Ayurveda experts following that is failure of Ayurveda experts. Modern medicine is following a systematic protocol, well and good. That they are proving that they are very systematic, they are professional in their handling. But when Ayurveda experts do not have that, in spite of the fact that Ayurveda is an officially recognized medical system of India, there are no specific ANC protocols in Ayurveda which are to be adopted by assessment of the woman. Assessment protocol should be there, which I told as one example. So this kind of protocols, ANC protocol in Ayurveda not there means in only one thing I need to say here, it is complete breakdown of Ayurveda Prasudi Tantra. Ayurveda Prasudi Tantra experts of modern era. Complete breakdown because it should have happened. It should have happened long before. ANC protocol should have been. There is some doctors are very proudly telling their, the women who are attending their OPD to take iron and calcium tablets, Ayurveda doctors. It's a matter of shame. It's a matter of shame and disgrace for the medical system also, not only to them. In spite of this much vast and deep science of gynecology is explained in Ayurveda also, when the community, professional community is not ready to take up and apply intelligence, understand and apply, means it is complete breakdown of Ayurveda only. Ayurveda community only. Not Ayurveda, it is Ayurveda professional community breakdown only. That is the only thing I need to say here. Yeah.
Actually, how to comprehend this deficiency is not deciphered in Ayurvedic science or in by this Ayurvedic experts, Prasudi experts. That's why when iron deficiency is seen, iron is given. The bhojanam hina matram tu na bela upache aujase sarvesham vadaroganam hedudam cha prabhadyate. So it is not one deficiency will be causing, and the treatment principle is you can give that thing alone and it will be absorbed. So for iron deficiency, it is treatment is not giving iron. So food always should be shadrasa mathura prayam and snigdhoshna lakhu. Along with that, we can administer medicines which helps easy absorption, and so if you give one micronutrient, it will not definitely get absorbed and it will not replenish whatever deficit has happened. So it should be administered in the proper way, and it should be comprehended first in the proper way what the exact cause is, and reverse the cause mechanism, and then administer healthy diet in proper time, in proper way. Hidahara, Vidahara, and Samayabhuk, Kalabhuk should be there.
Yes, sir. Thank you, sir. Thank you, ma'am. Next question was also like that only. Is it necessary to know about post-OP management as per allopathic medicine, like use of antibiotics, painkiller, etc., fluid therapy? What does scientific Ayurveda offers here? And what is the your view on postpartum Panchkarma package?
Actually, postpartum care immediately after delivery, most of the women are undergoing this cesarean now, CSLC. So it is not cesarean babies or normal birth babies. Whatever it is, mother has to be taken care of in the first day, from first day itself for wound care. Wound care, whether it is episiotomy stitch or whether it is cesarean stitch, wound care is to be done by Ayurvedic scientific principles and medications. That is to be possible. Then only we can consider Ayurveda Prasudi Tantra as a successful subject which deserves to be taught in BAMS and MD. After delivery, normal or cesarean, that trauma care, that wound care is to be done, and also infection is to be prevented. That is the first step. Woman should not go into sepsis, any fever, infection should not happen. So all that stages, and also there can be thromboembolic events, clot formation, PPH, postpartum hemorrhage, how to prevent, and afterwards how to protect. Anyway, the woman, if it is handled by modern medicine also initially, afterwards, after 2 days or 3 days, whether the woman is available to Ayurveda, what is to be done? If there is excess bleeding, how to control the bleeding. And second thing, after a few days, initial stage is for wound care, prevention of infection, immune protection, and hemolysis. That's why Panchagola Churna, Deepana Gana is mentioned for not only for Deepana, it is shown in the Sanghada Bhejana also. So it prevents the formation. There is a very high chance of blood clot formation immediately after delivery. So, that in order to prevent that, maybe Acharya has mentioned specifically Panchakola Peya. Nowadays, modern medicine doctors are very much ridiculing all this. They are to be given solid food. Don't give liquid food for first 3 days. Modern medicine, it is handling like that. But Ayurveda doctors must know why it is so and what is to be done. And after that, what is the next step? Postpartum care. Next step is to optimize the metabolism and hormones. Hormonal function is to be optimized, metabolic status is to be optimized. Both of these should happen simultaneously after the wounds are healed, after there is sufficient production of breast milk and other factors. Woman is going to get her first menstrual period after 40 days, or some women later. If they are lactating, it can vary. So whatever it is, so metabolic status and hormonal status are to be optimized by encouraging women to get up and walk slowly, and also by Laghu diet and medication if at all required. This evacuation of uterus, Garbhashya Shodhana, that can be done by medication, proper medication, scientific medication chosen in Ayurveda itself. It is not like Arishta is to be given. It is not like that. We have to understand the woman's complete history and obstetric history, everything, and do the things. And metabolic status and hormonal status, after protecting that, optimizing that by specific guidelines, woman is back to routine. So this should be the postpartum care guidelines, which are elaborated in my book also on obstetric care. So there is nothing like that. In what I understand now, it is also done as packages. Main
Package.
medication, Dashamula Arishta, Jeeraga Arishta. In Kerala, it is, I understand that 7,000 rupees package. People are getting without even showing a doctor also. They are able to get from Kottakkal or Vaidyaratnam or any Ayurveda shop when they go and ask postpartum package is required in Kerala. Any Ayurveda shop, when they go, they will get a package medication which can be used by any woman after delivery in any stage, whether she is having hypothyroid, whether she is obese, whether she had a complicated pregnancy and delivery. Nothing is considered in while prescribing medication, because it is not even prescribed. It is given. It is sold as a kit. So this has to end. Everything has to be. There should be policies framed by the government. The government is concerned of people always means there should be policies, specific policies to control all this. There should be clinical audit. There should be specific standards for prescribing of Ayurveda doctors. Nowadays, what is happening is everyone is blaming the quality of medicine. But it is not the quality of medicine always to be blamed. Quality of prescribing matters more. There is no quality control for prescribing today. There is no clinical audit. Anybody can prescribe anything in pregnancy. When you check internet, you will get so many advices. People are prescribing online also, online consultation also. Doctors are prescribing medications. So this is very dangerous trend.
I would like
And
to add one point.
regarding water intake also, there are so many myths like after delivery, less water, or if a woman consumes more water, then it can cause abdomen sag. Like that, so many myths are there, which are being interpreted as Ayurveda. It's not fair, because after delivery there are more chances of urinary tract infection, constipation, etc. So physiological causes are also there for constipation, and whenever the woman is having normal labor also, afterwards constipation tendency will be high. So in such cases, rectal suppositories and all are used by doctors in allopathy. But in Ayurveda, we have to advise medicated water in sufficient quantity. We cannot restrict water like that by listening to myths. Nowadays, what is Ayurveda, what is tradition is not known to public. Public consider every superstition, what is existing, what the traditional Vaidyas are prescribing, everything what they consider as Ayurveda only. So the problem is that they can land in so much of health calamities.
Yes, sir.
Yeah, I would like to add one point or remain about a point that whatever is done on after delivery will be affecting baby also. So if you do Shodhana Chikitsa, it will be affecting baby also. If you do give Arishta Asavas, you are giving medicated Madhya itself to the baby. So whatever you are doing till involution or after involution of uterus also, if you are giving any sort of medicine, that is going to affect the baby also. So not only the health condition of the female is affected or the mother is affected, it's going to affect the child also. So immediately after delivery, antibiotics are given.
That's why.
So immediately when the baby is born, baby is getting Visha only, antibiotics. So immediately after birth, it's getting first thing is antibiotics. through breast milk. So whatever Ayurvedic, whenever you are following Ayurvedic principles, starting from wound healing itself, it should be followed. Otherwise, it will be affecting both mother and child.
Thank you, sir. Thank you, ma'am. Vidita, next question. Sir, there's this question Dr. Pranita asked here. What is the role of Basti in 8 months of pregnancy? What is the role of Basti in pregnancy for normal delivery?
Yeah, it's the period
Somebody
for
has asked.
Vata and Lobana. So it's a technical question. So this is the program is how to learn to understand. So it's for Vata and Lobana. So basic thing I can tell.
Vana.
Uh, Sir, ma'am, my next question is surgical emergency, which is rampant in today's era. When the case come to Ayurveda also, we do not have much to offer, and moreover, it's being irrationally managed, as you have told in previous question. So, what's your view on this? Also, do we need to learn surgical process like DNC, DNE, myomectomy, cystectomy, etc.?
That is completely like if a Prasudi Tantra expert means surgical procedures are very much mandatory to know. There is no doubt in that. Suppose, and we cannot be restricted by for doing all these Prasudi Tantra, all these surgical procedures. If a Prasudi Tantra expert wishes to be an obstetric or gynecological surgeon, he or she cannot be banned for it. They have equal rights as MBBS doctors. But the thing is that it is purely a skillful job. Skillful. It's not like intelligence. More than knowledge, skills are more important in adopting a surgery. Knowledge, of course, is vital, but skills and knowledge simultaneously happening by practice only. So if BAMS students are allowed to do these procedures, if in MD also, if they are allowed to do these procedures and post wound management, etc., by Ayurvedic, strictly by Ayurvedic scientific protocols, then it is okay to learn all these. DNC, whatever it is. Ayurveda expert is also doing DNC, and everything is done as per Ayurvedic protocol later. Then it is okay. But these technical skills, we have equal rights to understand, learn, and practice without any modern medication, without the necessity of. Then you may be asking anesthesia. Anesthesia, definitely now we have to go for modern options. No other options are available in anesthesia. But that we are not doing, anesthesia expert is doing. But surgical part, once a doctor of BAMS or MD or MS is trained in it, properly trained in it, not only surgery, even labor also. Labor also, natural labor or cesarean or complicated labor. Definitely Ayurveda obstetricians should have sufficient knowledge. Their rights cannot be denied. In Kerala, we have a lot of restrictions. The students, BAMS students are not taught labor procedure. Even MD, Prasudi Tantra also, they are learning with difficulty. They don't have any experience. Even when they join as faculties in Ayurveda college also, very few colleges are having conducting labor. So this is a very major lacunae in Ayurveda professional education. This should be there. And post management should be done by Ayurveda, scientific Ayurveda protocols. All these things, DNC and whatever it is, it can be learned by Ayurveda doctors with skillful training. That is very important, not merely theory learning. If theory is taught, definitely practice should be taught. Training should be given in the practice course.
Surgery was initiated by Susruta only, father of surgery. So those technical things which modern people are using, we can also adopt that, but it should be trained properly, and wherever surgery is required as per Ayurvedic science, there are indications and contraindications. Where to apply Shalya, where to apply Agni Karma, where to apply Kshara Karma. All these are very specific. So both Kaya Chikitsa and Shalya should go side by side. In all diseases, these things can happen, not only in Prasudi, Udara Roga, Vritti or Ashmeri or Arshas, or including Mudha Garbha. So what all procedures are to be done and how to do, everything is very much specifically mentioned, and how to do, which Shastra is to be used, Mandalagra Shastra or other Shastra, whatever is needed to be used is very specific, and according to indication and contraindication, we have to adopt that. That has to be technically skilled people should teach, they should develop, they should teach, and it should be implemented in the most scientific manner itself. If you are just simply referring to modern hospital and doing is not Ayurvedic, what is intended in Ayurvedic science, or what is advised by Ayurvedic scholars or preceptors.
Thank you, sir. Thank you, ma'am. Next question, Vedita. What is the utility of Sthanik Chikitsa, which is widely used in Prasuti Tantra department in almost all cases?
I think Pichu, Uttaravasti, etc. No? Which are the procedures used, adopted generally?
Yes, ma'am.
Chalana, Pichu,
Same, ma'am, that you told.
Uttaravasti, all these things. Actually, we have to understand leukorrhea, every case is handled by Uttaravasti, by one Prasudi expert. So it is not like that.
Yes.
We should be understanding the cause mechanisms wherever local Pichu is required. Pichu is required means there Pichu can be done. It's not like every case has to be managed by Pichu. When a pelvic inflammatory disease is there or infection is there, vaginal infection is there, Uttaravasti is required, it is foolish. It's not the way. Infection is to be treated by infection principles only. So such kind of demarcation is not there. That's why this Sthanik Chikitsa alone is kept as a topic in syllabus. It is not required as a separate topic in syllabus. That is wrong only. Everything has to be taught in its own context. It is like focusing, highlighting on Sthanik Chikitsa means when the patient comes, always students and doctors will be thinking about Uttaravasti or Piju only and not the patient. That is not the way. Everything has to be taught in the context.
When these Sthani Chikitsas are taught separately, like Uttaravasti and many other things, they will be thinking only of those treatments, how to apply those in patients. So it's not the way it should be treated. Just like Panchakarma experts will be thinking everything in the perspective of Panchakarma only. So in this case, how to do Vamana, this case, how to do Virejana, they will be thinking only in that manner. So when you are trained in such a way that practicals are not in the patients and just explaining all these things, and these things are to be done in the patient, then estu karmasu nishnado, tashtya shastra behishkritaha, without assessing shastra, sa satsu puja na apnodi. When you are experts in karma, you will forget shastra. You will not be thinking of shastra, and you will be simply applying all those procedures on the patient, and thus satsu pujam na apnodi. They will not be able to cure the patient, or they may end up in some dangerous situations. So that is not the method to learn. It should be clinically taught and clinically applied and clinically comprehended. So it's not like learning as separate under a separate topic like Sthani Chikitsas. If you learn and if you write practicals of that, you are not going to treat the patient properly.
Thank you, sir. Thank you, ma'am. My next question is whether any standard algorithms to estimate female infertility for Ayurveda physician or mere trial and error practice is done. Is it mandatory to do Panchkarma for infertility treatment?
As I told you, Ridu Kshetrambu Bijaram Samagriya Damburo Yadha. So, internal environment, Bija Dushti, Shukra or Artava Dushti, it has to be appropriately handled, and the cause of Artava and Shukra Dushti are to be deciphered by whether it is Rasa Dushti, whether it is Bija Dushti, Shukra Dushti, Artava Dushti, or whether it is what you call Sama Dosha, Ama Visha, Agni Dushti. All these aspects of infertility, sometimes it can be by endometriosis, sometimes it can be by fallopian tube block, sometimes it can be anovulation, more commonly anovulation. Again, anovulation doesn't mean panchakarma. Hypothalamus, pituitary, ovarian cell to activate nasya. All these stupid things are going on. It's not like that. Panchakarma is not a universal antidote for infertility. So we have to understand why. If it is by what cause an ovulation means, which stage of ovulation is getting impaired in Ayurvedic perspective, whether it is Nehakshaya or whether it is what you call Samana dysfunction Nidanas, or whether it is Artava Agni dysfunction leading to Shukra, impaired Shukra Poshana and impaired Ojas. Ojas is formed during ovulation. So whether it is Ojo Agni, as such Ojo Agni Mandya, or whether it is Shukra, improper Shukra Poshana, or whether it is by Artava Agni improper functioning, which stage of ovulation it is impaired. If it is by Shreya, or whether it is by Sneha Vriddhi, or whether it is by Kabha Vriddhi in Kabasthani Dhadus, as in PCOS, whether it is the reason. So that is to be properly focused. Which part of why it is an ovulation? If it is hypothalamus, pituitary, ovarian cell axis, hypothalamic amenorrhea is there, and hypothalamic causes can be there for an ovulation. So there, what has to be done? How it is to be deciphered in Ayurvedic perspective. So these things are to be taught first of all. And if it is not by an ovulation, sometimes it can be primary infertility or secondary. That is to be known. If it is primary, immune factor is very important. Sometimes torch infection or something will be there. Viral infections in pregnancy can cause or prevent the woman from getting conceived. Sometimes it can be by immune, what you call autoimmune conditions like antiphospholipid antibody, etc. Antibodies are developing against the fetus and the fetus is being expelled. There are several different kinds of antibodies which are being checked. Sometimes it can be metabolic imbalance, right? So it is not, sometimes it can be congenital also, congenital problems also, which is responsible for infertility. So infertility, there is no antidote. There should be scientific, rational standards to assess a woman systematically. Infertility, rule out this, rule out samhanana of the woman, pramana of the woman, how much metabolic status, whether it is optimal metabolic status, optimal hormonal status, whether woman is being treated for any other conditions, whether she knows about the fertile period and all. That is also important. Fertile period, many women are not having proper knowledge, and it can be simple reasons like mental stress or something. Sometimes inappropriate treatments will also cause infertility. Ayurveda or modern medicine or whatever it be. So those treatments are to be stopped and proper treatment is to be given. So infertility is a complex actually. It is not a single cause oriented. So there should be rational algorithms formulated for assessment of the woman. And once assessment is done properly, we can frame management guidelines according to cause. Annulation, adiprenana or aprenana or artavagni mandya, whether it is by impaired shukra poshana, which stage it is happening, or whether it is by progesterone deficiency that it is happening. Everything has to be deciphered in Ayurvedic perspective and handled by Ayurvedic scientific principles. So it is not Panchakarma that is required. Dosha Dushti in Artava and Shukra can be eliminated by Shodhana or Shamana, mostly easily by Shamana. And which part of, which aspect of that reproductive cycle is getting impaired, that is to be assessed and guidelines are to be formulated specifically. It's a very necessary thing today because so much of irrational handling of infertility for endometriosis, for tubal blockage. I'll give you one example: tubal blockage, fallopian tube blockage. Uttaravasti is being done, I think, many Prasudi IPDs. But fallopian tube blockage is because of pelvic inflammation, pelvic inflammatory disease, or it can be by endometriosis, or it can be by adhesions or some previous surgeries, sometimes by chronic inflammation. The tube might have been blocked. So when we are doing medical guidelines itself, no procedures or interventions, the tube will become again open, patent. So this kind of knowledge is very important to understand and reverse the cause mechanisms.
Actually, in healthy status, Shukla and Artava would be Sutta itself. So healthy status is to be attained first, with which we can identify the status of Shukra and Artava also. Like Dhatu Samya Lakshanas have to be assessed first. And if you are assessing factors, you have to assess all the Panjavayus, Agni, hormone status, also Rasa Rakta, which are involved in the formation and development of a menstrual cycle. Rasa Rakta are having important role along with Shukra and Artava and Ojas. So all these factors have to be assessed. Plus Sattva also is to be assessed, which is achieved with Dhatu Samya Lakshanas itself. And earlier itself, the first, second point answer was told that Shuddhi is not Sodhana. So Dosha Sodhana is done with Panchakarma, and Shuddhi is when Agni is proper. In healthy status, when you kindle Agni, that produces more and more Shuddha Shuddha, Shuddha Artava and Shuddha Shukla.
Thank you so much, ma'am and sir. That's all for today's. I guess this was the longest episode. We have almost take 1 hour 45 minutes. So, so we will meet in the next episode. Thank you so much for imparting your precious knowledge on the Prasuti Tantra exclusive. We are blessed to have that all knowledge and with all audience. Thank you so much.
Thank you.
Thank you, ma'am, and
Thank you.
thank you so much.
Thank you, Vidita.